afternoon. We're going to get started. We're a couple minutes late, but again, I'm Beth Droppert. I'm the Vice Chair of Health Advocate X, and I'm delighted to be able to introduce this title and these three speakers. Today we're talking about access is everything. Can you be quiet, please, back there? Access is everything. Practical and proven ways to achieve equity in your advocacy practice. And we have Brad Schwartz from Greater National Advocates, Avram Fox from Chicago Patient Advocacy, and Rebecca Acosta from A&J Patient Advocacy. And they're going to probably sit. Are you guys going to sit? Okay. No? You're going to stand. Okay. And then make sure, because it's recorded, that when we do the questions, you wait for the mic. Okay.
Huh?
I'll be the clicker.
All right, cool. How's it going, guys? All right. I want to find out, I know a lot of faces, but I want to get a real good idea of who the room is made up of. Practicing independent advocates. All right. What are the rest of you? No, are there wannabes? Are there newbies? Are there we got some people coming in curious, interested? All right, cool. Well, that helps because could help give a little insight into what are some of the matters that we are thinking about as a profession. And obviously one of them is serving the people that we claim and proclaim to serve. I know that there are, well, let me just say this. I'm going to go right out and say it. The initial title of this session was supposed to be Our ethics require, what was it, do you remember?
No.
It was, do we have a responsibility to provide pro bono services, and should we? But we kind of broadened it a little bit here, but I really think that that is going to be the focus of this. I believe that we do have an obligation as a community to give back and support each other, okay? One of the things that we need to be very, very concerned about is when we start replicating the very system that we are trying to fix, we need to always keep it in our head that when people are calling us, they're not calling us to say, hey, how are you? They're calling because something bad has happened. They have taken it upon themselves to do some homework and find out about us. And the people that can't afford it, probably doing it on a cell phone, sometimes with no service in a rural part of a state with no internet, for them to take that leap because we're doing such a good job of raising awareness, reach out, call for help, and get told, I'm sorry. You got to sign the contract, and it's going to be $250. I'll tell you what, I'll give you a break, $1,000 for the first 4 or 5, and we'll go from there. It's not what this is about. That's not why we got into this field. It's not why we are calling ourselves advocates. It's not why we are touting that we want to fix a broken system. So with that said, let's talk about the broken system. Slide 1. Look at this. You boil this down and just check it out. I mean, numbers, statistics, they're great. I could boil this down. You could look at them. But the bottom line is, we all know why we're here. This stuff sucks. Okay, you don't want to be stuck in this system. You want help. So how do we do it? Is there a way to incorporate these types of pro bono services and make it a viable practice? Yes. Keep going, more slides.
Well, it's showing the purple slide of that. I don't know what that.
Oh. Look what I did.
I am not the person that should be doing the displays.
Oh, it's all right here.
And I'm also an Apple person, so, so sorry. No, it's in, it's plugged in.
All right, well, let's talk about the question of, let's talk about ethics, okay? And whether or not the advocates do have a responsibility to provide pro bono services. I guess you can read the Code of Ethics. I'll tell you all where to find it. But the bottom line is, it depends if you are a originalist and a strict constructionist, or if you believe that this Code of Ethics is a living, breathing document. I could talk about that, but I want to talk about that during the Q&A. I would like to hand this over right now to one of my esteemed professional friends, a mentor. Yeah. I could not be happier to share the stage with these two people. Avram Fox, Chicago Patient Advocacy. He's going to tell you how he does it.
Following Brad Schwartz, even though we only talked for 6 or 7 minutes, is a very humbling experience for those of you who know him. And so when it comes to mentors, heroes, people that are so extraordinary that you don't have enough words to describe them, Brad Schwartz is certainly almost at the top of my list. I'd say after 52 years of marriage, if my wife didn't put her at the top of the list, I don't know whether she would be a happy camper, so she certainly is there. And it's just extraordinary also to be with Rebecca Acosta, whom I met in person a year ago in New Orleans, and she is just an absolutely remarkable woman. And yes, statistics are important, and yes, this whole concept of codes of ethics and pro bono services are certainly important, but I want to try to frame some of my perspectives without such emphasis on what's not on the screen, if I can do that. Okay. So one of the things that Brad essentially said without saying it, so I'll say it my own way, is that 90% of the American population is not able to take advantage of our services. 90% of the people in this country, granted that includes children and people who perhaps ordinarily wouldn't be counted, but 90% of people, adult people who need our services, cannot afford what we typically will charge. And when Brad referenced, people live in the country, the fact is that part of it is that there's a total lack of accessibility. There were some statistics dealing with poverty, dealing with how many people are uninsured in this country. It's a litany of facts which you all live and breathe every single day of the week. You know about these facts. They're all part of this wonderful U.S. American healthcare system, which, although we say it's the best healthcare system in the world, I think we can also suggest that it is very badly broken, very badly broken. And so in this very badly broken system, here we are, if you think about our profession, what we're trying to do is to bridge this gap and help people navigate the healthcare system. That's what we're trying to do. That's our mission. That's our goal. And yet, if you think about our goal, there's a kind of a dichotomy. We can't really achieve our goal because we've got the same problem with our own rather young profession. Namely, most of the people cannot afford to pay us so that we can achieve our goal. It's a kind of a conflict, which is very, very difficult to reconcile. Yes, there are major things that have developed over the years, and I started doing this very part-time some 12 years ago. When you listen to Solace, the Solace company talk about the notion of developing a relationship with CMS, and people can now get a $40 an hour reimbursement rate. I mean, the first thing that comes to my mind is how many advocates that are charging numbers in some cases that I can't relate to, 150, 200, 250, 300. I charge 100 or 100 and a quarter if I charge anything. But the fact is that how many people are going to take advantage of the Medicare reimbursement opportunity? I don't know. Now, I acknowledge the fact that there are many young people who've entered this field, which is phenomenal. The old people like me who entered the field 12 years ago, I look around the room, I don't know that there are too many left, at least at my age, but the fact of the matter is that it needs to be a field where you can make a comfortable living. And so this whole notion of ethics and pro bono becomes a real serious kind of conscious issue when you need to make a living. People that are older have already made their living for 45, 48, 50 years, and perhaps are not as dependent upon this, even as a supplemental situation, even for supplemental income. And so we have this dichotomy. I want to mention something to you. Brad talked very passionately about, he used the word the code of ethics. That's the code of ethics within our profession. You can find it in any number of places. I'm sure the PAC board has it in their documentation. I'm sure NAC has it in theirs. Everybody has it. I want to talk for a moment about a different code of ethics, one that's far more significant. I don't know whether everybody in this room believes that there is a higher being above us. I certainly do. I have total regard for people who don't, but I think most of us can say that we do. And so in the Judeo-Christian doctrine, for those people who have followed or have any insights into Judeo-Christian values, there's something known as the Torah, which you've heard of, the Old Testament, and then there's something known as the Mishnah, which is the oral explanation of the Old Testament. And within the Mishnah, there's something called the Code of Ethics. There's a code of ethics within the Judeo-Christian doctrine, the fundamental human code of ethics. And what thing that it says, which is absolutely profound, it says that the foundation for us as human beings is that there are three things on which the world stands. There are three foundations for our world. It's a tree with three big branches. One branch is called tzedakah, which means charity or righteousness or justice. That's one branch. I don't think we have any argument with that. The second branch is called chesed. Chesed means kindness. I'm sure we're all kind. Particularly, we're all kind given what we do for a professional living. The third branch is an extension of the first and the second branches. It's called gemilut chasadim, which means acts of kindness. So what is an act of kindness? I think that's subject to interpretation, but it's very easy to transpose that notion of a biblical act of kindness, act of charitable kindness, into what we do. And so the question is how can we apply this Judeo-Christian ethic into our own professional code of ethics and try to make a difference, try to be an upstander, try to take a stand. I think that there are many ways that we can do it, and I think all of us, to the extent that we can, should try to do something. And I respect and acknowledge young people are trying to make a living, and this is not an easy field to make necessarily a comfortable living. Maybe it's changed over the last 11, 12 years since I went into it, but the fact that, and I do this part-time, this was a new profession. But how do we deal with people in the inner city who have no insurance, people of color, who need us? How do we deal with them? When Brad Schwartz called me, and I'm going to say this quite quickly, I never heard of Brad Schwartz. He never heard of me, but roughly, probably about, I'm going to go back and say about 8 or 9 years ago, maybe a little less, maybe 8 years ago, Brad, through his law identity, Brad was a medical malpractice lawyer. He still is, although he may not be actually actively handling the legal side. He's an intermediary. I'm sure that many of you have called him and gotten advice from him on that subject. But somebody apparently who was somebody living very modestly called him and said, "My wife is a victim of medical malpractice. She suffered a major stroke, and she's now permanently disabled. She's on a ventilator, she's on a feeding tube, she's got major cognitive deficiencies as a result of what happened." And the husband, who's very smart, reached out to Brad and ultimately decided that he was going to, through Brad, pursue a medical malpractice case on behalf of his wife. So I get this call one day from Brad Schwartz. I didn't know him, and he says, "Avi, I think you're the third person that I'm calling. You know, I went and I Googled patient advocates in Chicago, and he said the first two said they can't help me. And Brad said to me, 'Let me tell you, Avi, I need some help. I have a client who's on a ventilator, who probably will be significantly challenged, who has Medicaid, who's not yet 65, okay, no Social Security, essentially no income. She's in an acute care hospital, having been in a hospital for a long time, and they're now trying to throw her out. So I've got 48 hours to get her into a long-term care skilled nursing facility. Can you help me?'" I think about patient advocates, and I recognize that I'd say 95% of the people in this room that would get that call would say what the other two people that Brad said, "No, I can't help you." I mean, it's an order that's so tall, why would anyone want to try to, almost traumatize themselves by getting involved trying to fill that kind of an order? Well, I was very moved by my conversation with Brad, and I made up my mind there has to be an answer. And I'm going to go fast forward 7 years later. 7 years later. I mean, how many of you have had a case for 7 years? 7 years later, given the relationship that I was blessed to develop with this client and her husband and her family, with Brad playing his role, with the medical malpractice legal team playing their role, this woman is now living as qualitative of a life as possible. They won a massive, extraordinary award. She's now getting the kind of medical care that they could never dream about. They have such amounts of money that her husband has now purchased a magnificent home that he's retrofitting so she can have an elevator and a gym in her home, and on and on and on. And one of the first two calls that the husband, Dennis, made when he was advised of the award was to me. And the call was, "Avi, I want you to remain on as Sherry's private healthcare patient advocate." And I had to be approved by the guardian of the trust in which most of the money was deposited. Can you imagine struggling with the healthcare, with the disgraceful healthcare system that we have to deal with, struggling to get everything that she needed, which was almost impossible, struggling to get her out of the disgusting nursing home after the disgraceful service that she had there, struggling to appeal to her Medicaid plan so that she could go home and have some in-home health care. Just watching and being part of the whole system was beyond the scope of what anyone could possibly imagine. And now just look at where she is today. And you know why? It's all about money. But it's also all about us. It's all about relationships. It's all about faith. And ultimately, it's all about that code of ethics. And so what can we do? We can take calls like that. And before we say no, think about it. I can't even begin to tell you that most of the calls that I get, I don't say, I'm very sorry, I can't help you. I listen to the person, even if it's sometimes for an hour. How can I help you? Tell me what your problem is. And I happen to be somebody who specializes in mental and behavioral disorders. The reason I chose that specialty is because it's the biggest valley, it's the biggest cracked piece of our system. There's no psychiatrists anymore available who even take Medicare. Most of them don't take insurance. And what happens when people have breakdowns, suicidal people who wind up in ERs and sit there for a week or 10 days in Chicago, Illinois, because there's not a psych bed within any reasonable distance of the person, and desperate parents try to find a patient advocate to help. And so I don't turn those calls away. And some people here and there will pay. And so I think we need to listen to the person who's in need crying out to us, even if we don't do any more than that, provide them with support. I always will follow up on that kind of a call. How are you doing? Call me whenever you want. I don't consider that person to be a client. So I think pro bono consultations is something that each of us should set aside some amount of time to be engaged with. I've had situations of people who have a major issue with insurance or with Social Security, SSDI. They need to get on an SSDI roll because they were diagnosed 3 months ago with stage 4 pancreatic cancer. They don't know what to do. Can you help me? So in this case, I just got one 3 days ago. I can help you. And the wife got on the phone and said, how much do you charge, Mr. Fox? And I said, how much can you pay? It's not important to me. And she said, well, how much do you charge? I said, I'll tell you what, this is probably going to take me 15 hours. I don't know how many of you have tried to get somebody onto an SSDI roll. It's compassionate. It's a compassionate situation. It's very challenging. I don't recommend it. But I said to them, can you do it? Can you pay me $250? Because she wanted to pay me something. It's going to take me hours. Now, that doesn't mean I'm giving them anything, but at least I'm making them feel some sense of self-esteem, because these people didn't want it for nothing. They wanted to pay something. And so I don't need to go anymore. I'm going to end here. Thank you, Brad. And it's my pleasure to call on my friend and colleague, Rebecca Acosta.
All right, I am going to flex my mom muscles while I'm going to do the clicker, the microphone, and my notes. So
That's why I stuck to 6 minutes, by the way.
be careful. Okay. So I am the founder and executive director of A&J Patient Advocacy here in Nevada. I am one of the 3 or 4 locals at this event. So I'm happy to give recommendations on food, transportation, as long as it's not on the strip. You're on your own. So like I said, I'm the founder of A&J Patient Advocacy, and when I started my practice, I did so purposefully as a nonprofit. I provide all of my services 100% free of charge. I don't ask if you're able to pay, what can you pay, none of that. It's just 100% free, no questions asked. That includes children, teens, young adults, and their families. So arguably the most vulnerable of our population. So the time that some of you who are in a for-profit practice might spend on finding clients, getting clients, I've seen a few interesting sessions here this year about that. I dedicate to fundraising. So tomato, tomato, same hard work and really grinding. Let's see if I got, okay. See, I'm really not really great at this, I can already tell. So by nature of how I structured A&J, I quickly learned the hard way that I had to scale my activities to serve a bigger audience at one time. Oh yeah, here we go. This gives Avi something to do. The down arrow. So I've learned to scale activities to serve a larger number of clients at once. My favorite is the 30-minute workshop or presentation, and also attending health fairs. So no matter the difference in how we execute our practices on a day-to-day, I wholeheartedly believe that every advocate can and should give back. So I am going to share a little bit about how I give back, and I think that there are practices that you can copy-paste and apply into your for-profit practice. So while we are giving back to our communities, which is, as a human, I am wholeheartedly behind. I'm the daughter of a teacher and a social worker, so I was indoctrinated in the womb. It's also fostering goodwill as an independent advocate profession, right? We are a baby profession, 6 years in technically, even though I know there are some advocates been doing it for decades, and I highly commend your work. But we need to foster that goodwill. We need to spread awareness, and it needs to be a household term, patient advocate, right? I can't tell you how many times I've answered, what is an advocate, over the last 6 years. And frankly, I'm annoyed and tired of doing it. So we need to work on that together, please and thank you. Can we go to the community resources slide? Avi, you're failing at your job. You had one job, Avi. Go backwards. Doesn't everyone have an Avi in their life? Isn't this so fun? Okay. So knowing what resources are in your communities are a crucial skill and activity that we do as advocates every day. However, a lot of us don't do the opposite to make sure those community organizations, partners, health systems know us. Our names, our faces, our work, our organization, our practice name, what the heck an independent patient advocate even is. So I am big on being in the community, talking to everyone, even though I'm an introvert, believe it or not, Mark Berlin. I know, right? Why you? Come on. One of my, I guess, trial and error type of community, like, let me see as I went to the county health department. Wow. But they loved it. I've never felt so validated as a professional. Like, oh, you kind of understand what I do and you want more information and want a partner? This is great. So of course I have flyers and leave behind cards and all that traditional marketing stuff. But the health department has been like almost a gold mine. If I was a for-profit practice, this would have been like, woo, yes, line them up at the door. But, you know, they have bulletin boards and their community boards. They also have digital boards and their digital newsletters that they send out to providers, health systems, patients. Like, it is just a free, massive marketing network, right? And then they get to know you, right? They get to see the words patient advocate. They get to see your name, your face, your logo, whatever it is. But patient advocate is what they're going to take away. So again, that goodwill and just building up our profession as a group. Oh, another tip is to connect with the community health worker organization in your state, because those are, it's a national profession, but they are governed, if you will, and licensed at the state level. So for example, here in Nevada, we have the Nevada Community Health Worker Organization or Association, and that's who does the licensing, the training, the CEUs. You know, we have a lot of crossover, and they are obviously very embedded in the community, but there are gaps, right? So how can you work together to fill the gaps? Or is there something special in your community going on that they know about and you don't know about, but you're the person perfect to fix that problem? So finding like-minded people, adjacent professions. I work with kids, so obviously I work in schools a lot. Wow. Yeah, wow. So there's just so many opportunities to go out and meet people in the community and learn about their work and how it can go hand in hand with yours, or if there's a crossover. And another thing is for advocates who focus on a specific population, like for example, me and kids, right? I'm in schools, I'm in everywhere that kids go. Their health is not checked at the door. If they have a mental or behavioral health problem, that's not separate from their physical health, how they learn, how they interact with their peers, how they are with their families. So I would like everyone to consider, if you work with aging seniors, if you work in medication specifically, go to the established organizations that treat or serve those populations and figure out how a way to collaborate, right? You both have the same set of clients, but you both can't do everything that they need. So let's work together. Let other organizations, if you work with heart patients, like you should know your local chapter of the American Heart Association or whatever organization is there. Partner together, because there's still lots of work to be done. And wow, the clients that will come knocking at your door that are able to pay for some services because they heard about you from this other organization that's on the news and on billboards, kind of thing. A lot of places that I've heard of advocate colleagues in other states being successful, or with like senior centers, community, cultural centers, or cultural neighborhood health clinics. If you have tribal lands in your area, there's lots of tribal land here in Nevada. That's an entire another population that is, there's no word less than underserved, but like not, yeah, negatively served. And public libraries, I'm a library nerd. They do everything, and I have been asked 10 times probably by the 2 public libraries here to do like a 30-minute workshop presentation on XYZ topic. So that's libraries, yay. Okay, Avi, I think you can go to the next one. The down, is he still clicking or no? Oh, nope, other way. We're taking this show on the road, you guys, I promise. This is gonna be great. So in my first year of practice, probably the first month, I learned the hard way the limits of my time, my energy, and my patience for answering the same thing over and over and over again, which is 0. So I created a 30-minute presentation that I could adjust to the specific audience with a little bit of effort and just a little bit of time. It just focused on what a patient advocate is, general professional information, and then a 10,000-foot overview of the local healthcare system here in Las Vegas on the pediatric side. Stuff that is in the news, and some of it's common knowledge, but just really bigger picture to say, yes, you're in the thick of it, and it really is this bad, and here are some resources that you absolutely should connect with, and if you have XYZ issues, you can come to me and we can work together. The whole work smarter, not harder quote that I used to hate until I became the founder and director of a nonprofit, and then, yeah, anything I can do to help myself. So in the last 4 years, I've given that 30-minute community presentation, I have no idea, 50 times. But I can tell you that I am up to 25 active community partners who come to me for resources, information, expertise in a certain, hey, how do we handle this situation with our group of clients? And then I get requests for specialized presentations. So this summer, I actually collaborated with 2 attorneys at the Southern Nevada Legal Aid Center, and we did a workshop for families who have young adult children, 18 to 29-ish, that have developmental disabilities. And we did the workshop solely on guardianship and the alternatives and long-term health care planning. It was a 2-hour workshop, and it was held at a local university who has an autism center, and they also have a medical school, a DO program. There was 300 people in the audience in a room for about 50 people. They had a lot of their medical students in attendance and all their residents there, and then of course all of the autism center providers, and then families. We were expecting 15 families to attend. So that was an absolute awesome thing, and just that accidental relationship that I have with the Autism Center for kids, I now had an audience of our young healthcare professionals, which is always who you want to attach and affect early on. And then this fall, I'm going to be starting a workshop series with Gigi's Playhouse of Las Vegas. They are a national nonprofit Down syndrome achievement centers. And so the Las Vegas Playhouse just opened up earlier this year. And so I've been working with them for 2 years roughly while they were in their planning stage to come up with a series of workshops for families based on their children's age or stage. So for birth to 5 years old, what do you need to know as far as your kid's health? What are the resources? How do you get ready to transition from early intervention to school and all these things? So that will start in October, and I'm so excited. So we'll do one a month for each age range. And again, that relationship is totally by accident because we had tables next to each other at a health fair. Yeah. You can go to Avi, down arrow, please. Yes, we're getting it, okay, so aside from the workshops and presentations, there's lots of local events that I suggest people tap into to give that little bit back, right? So whether it's a 1 hour thing or a half day health fair event, back to school health fairs are my favorite, again, kids. It's just fostering that knowledge of the independent patient advocacy profession, and again, the goodwill. Let's see. Oh, another great thing about health fairs is that you are in a set location and time for a certain amount of time. You can answer questions and maybe help with a hot button issue, but then it's done. You don't have to, you're not onboarding every person that comes to your table. You might get a few clients that you end up onboarding, but it's just a good 2 hour, feel good, give back. But then you've got 200 people that now know the words patient advocate, right? And they know who to come to when they have a question. Okay, down arrow, Avi. Lastly, this is a short list because I don't do anything short, so this is short for me. A list of organizations and ideas just to consider to reach out, network, collaborate in your local communities. So that might be called different things in your state or your city. But please snap a photo and let me know which ones are successful or not. I'm just curious. I forgot about that slide. Yeah, that's good. Perfect. So yeah, just in closing, I just want to thank everybody for coming and remind you that, as humans, we are all here to work together to give back, to foster this awesome profession that we are all part of, and, to bring on as many voices of patients that we've helped, providers that we've worked with, to join in the collective voice of independent advocacy and really just showing everybody what we got. And now Brad.
So, thank you. Nice. All right. What was I gonna? Well, one of the things. Huh? All right.
Yeah, there you go. What am I going to do with these guys? Huh?
I know. One of the things, well, let me just say this, all right? You got 3 people up here. We're all on the same page. We're all on the same page. We give stuff away. And we also get it that not everybody can do that. No doubt about it. We're just trying to give ideas and, have everybody keep an open mind, because one thing that is just so important for the entire industry is for everybody to do our part, okay? That means, and Avi alluded to it and spoke to it a little bit, answer the phone, talk to people, listen to them, hear what they have to say. 9 times out of, well, not 9 times, maybe 6 out of 10, they just need to hear something, bounce ideas off of them. Don't charge for giving advice that is pretty much available in the public domain. You just happen to know where it is. Send them somewhere. And when it comes to the code of ethics, there are a couple of items within the collaborative code of ethics and the PAC board code of ethics that are worth noting. One of them is the fact that we are required to practice within our specific domains, within our specialties, and we're required to refer out when something is outside of the scope of our practice. Which begs the question, how do you determine if something is within your scope or outside of your scope of practice if you don't take the time to listen to somebody and hear what they have to say without first taking some money up front? I think that while the Code of Ethics doesn't specifically say you can't, you must engage in pro bono, I don't know. I think that if you put those two components together, you have to at least listen before you charge. So I think it's important, and the referral source is the other thing. I mean, we are required by codes of ethics to have a referral network, a competent, robust referral network. Why? We need to be able to hand stuff off, and everybody needs to take advantage of what everybody else is doing. We need to communicate with each other. We need to know each other's resources. We need to know who is good at what. I mean, that's how this industry grows. You just heard from Rebecca talking about everything that she does to get the word out. People start talking, you know? I mean, everybody right now knows what, Coke and Pepsi is because there was marketing that told people what it was. You don't have to explain that to them. We still have to explain it to them. But you know what? They used to have Coke and Pepsi, taste tests. You can go into the store, they give you some in the aisle. You got to try something. Try it, you'll like it, right? I mean, weren't there like ads about this? Try it, I forget what that one was. Nancy.
So, Brad, I'll tell you that was awesome. It was my cereal, by the way.
There you go.
It was Coke and Pepsi, too. But you three were awesome. That was great. Brad, GNA Now, I mean, when you made the directory, it was incredible. I don't know how long you made it. I've only been advocate for, say, 3 years, but it's awesome. I'm wondering, and maybe you already have this, in Massachusetts, we have our group, MACA, and when we can't take cases because somebody's too busy or whatever, we'll send it out to our distribution list in Massachusetts. If somebody can't take a case that was given to them through the GNA Now directory, how do we throw it back? Is there a way to?
Well, look, I will tell you this. You wouldn't throw it back. GNA website was designed to be as easy for advocates to find other advocates as it is for patients and loved ones to find advocates. So you can search granularly through the front end of the site looking for an advocate that specializes in knee replacement recovery in Tallahassee, and you'll see something comes, I don't know.
Yeah, I'll piggyback on that because I work with kids and young adults, and that confuses so many people. So I get a lot of requests for advocacy support for aging seniors or middle-aged, the population that I don't serve on GNA all the time, right? People are desperate and they're just like, advocate, Las Vegas, go. They are not reading their profile. Totally understandable. So I either call or email, whatever, and say, hey, I got your request. I serve only kids or whatever. That's pretty easy for people to understand. However, I have a colleague in town that can help you, or I looked on the website you were on and these 4 people are the next closest to you. Do you want the information? Can I email it to you? Can I text it to you? Whatever. That's just me. Because I have to, do I think sometimes, gosh, people can Google it. Can't you go back to where you were and just search a different one? No, because they're in crisis. I have to remind myself of that sometimes. So, Tammy in the way back.
Beth, while you're walking there, I want to ask all of you a quick question. Is that okay?
Can't we say no?
What would you do? You can say no, because I think most of you will say no to my question. What would you do, legitimately, if you got a call from an individual who says, I have an employee who is very sick. He's lost a huge amount of weight in the last 5 months. He has no access to doctors. He doesn't have any insurance. He doesn't have Medicaid. Can you help me? Well, that's a pretty elusive question.
What would you guys say?
You should help him. You're the employer. Why don't you give us some insurance?
Okay, so I said that. No. I asked that question. Fast forward, after about 5 minutes of probing, here's the bottom line. This man was his employer for 20-some years. The employee is an undocumented Hispanic American who's been in this country for well over 20-some years, who has 3 children who were born in this country. The man has no green card. He couldn't get a doctor. He'd go in and out of ERs, and at best, you know what happens in ERs. And the man was going to die. And this employer begged me. So he said, I've already called. I'm always the last guy to get the call. He called any number of patient advocates. Sorry, I can't help you. Sorry, I can't help you. And, you know, yours truly went, and I met this employer. I met this gentleman who didn't speak a word of English, not one word. A year later, he's fully recovered. He's back at work full time. He has a doctor. He was able to, by the way, I was able to get him Medicaid, which you can get for an undocumented worker. It is available. Most people don't even know that you can pull that off. And at the end of the day, when we think about the politics in our country, and I don't have to go there, and how these people are being described by certain politicians in our country, that they've come here and they're insane, they're crazy, they're this, they're that, they don't belong here, I'm going to ship them all back. We're in the state of Nevada. What would this state do without these people? It would be in big trouble. This kind of a hotel wouldn't even be able to operate. So I think the notion of undocumented workers as part of what we do is important.
Give it to Tammy.
So first of all, you guys are great. And I guess it's not so much a question, but I love how you started off with higher power, 3 pillars, and again, not trying to throw anything off on anybody, but, you know, biblically, we are to give back. And so in my arena in Texas, I'm a wife and a daughter of a veteran. I do all veteran benefits for free. I do not charge because I am a part of the auxiliary and I can't, number one. Number two, I'm in this country for free and living a life that's really good, regardless of what you think of our country right now on a presidential year. But it's good. And so I give back. I go to church. My pastors and staff get free advocacy. I love what you said, Rebecca. I do how to be your own advocate seminars. I go to independent livings, assisted livings, and things like that, and it's for free. And I teach people how to be their own advocate. So you give back, and you know what God does? He blesses you. So I would say to you, not just the panel, but I would say to you, when you say you don't do pro bono, don't think that every single person that hits your door is somebody that you have to help, but figure out for you what works.
Thank you. We're just going to do one more question, I think, and then more.
Hey, guys. Thank you so much for bringing this topic to today's discussion. I'm so grateful for that. For those of you that don't know me, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, founder and CEO of Tennessee Health Advocates, where we help individuals take control of medical bills without the medical billing department. So that's what I do on a day-to-day basis. But I love this conversation because I have, over the last few years, I have curated a free community of independent patient advocates. We're about 250 strong now. And what I really want to say in this arena, in this discussion, is that of that community, of all of those independent advocates that I work with every single day, and a lot of you are in here, all of us, Avi, to speak to this, would help. That's what this community we do is. And the wonderful and the beautiful thing about this is, if you're not familiar with Malcolm Gladwell, he has a book out that's called The Tipping Point. And to speak to the responsibility that we have as independent advocates, I think it's beautiful, right? Because in order for us to get to mass adoption and utilization of our services, we have to charge money and get the elite, the early adopters, because if we don't, we're going to end up like TiVo. And I know none of us want to go to the wayside like TiVo, right? And if you don't know what I'm talking about, read the book. It is amazing. So I say all of that to say that there is an individual responsibility in each of us to give back when we can. If I do a sales call, this just happened to me before I got on the plane to come here. I had a sales call, and at the end of the call, she was like, I want to work with you, but I can't afford what you're doing. I've decided I'm going to take a loan. No, you're not. No, you're not. I'm not going to let somebody that needs my services take a loan. I do that because it's the right thing to do. And as independent advocates, I know collectively that's who we are. So let's work together and do this and help everyone, not just the people that can pay our bills, but the ones that can't too, because we have a personal responsibility to do that. Thank you again. I love the conversation.
Thanks, everyone. And thanks to our speakers. We're supposed to turn the room sort of quickly because we have another talk coming up. But do you have anything else, you guys? Or?
Thank you.
Okay.